Paul is an experienced entrepreneur, a physician, and a scientist specializing in bringing mission-driven health information technology ventures to market. He co-founded TrendMD, which is the largest native advertising platform for academic research that is transforming how scientific knowledge is disseminated and consumed. In 2019, after growing the company to profitability and 150 million unique visitors per month, Paul stepped down from his day-to-day role as CEO of TrendMD to lead the strategic vision of the company as an advisor. He also recently completed his PhD for research that has advanced the fields of bibliometrics, knowledge dissemination, and scholarly communication from the Institute of Medical Sciences at the University of Toronto. And Paul is also currently completing his residency in psychiatry at U of T. So again, thanks for joining us this morning, Paul, or this afternoon, really. Fantastic. So I thought we would just kind of jump right in and basically kind of start with, what, if you could put it into your own words for the layman, what is TrendMD? What does it do, and how has it sort of, advanced the field of bibliometrics from what was there before?
So I'll kind of start off with giving kind of a simple analogy. So in a nutshell, what TrendMD does is we recommend content for academics to read. So the best way to think about it is if you imagine if you're on CNN or New York Times and you're reading an article, you're often faced with those sponsored links at the bottom of the page. TrendMD does the exact same thing, but we do it for academic sources. So an academic source would be like a journal like JAMA or New England Journal. So we work with these journal providers and we get our product, our widget, embedded on the bottom of the page. So for a reader, for example, let's say you're a doctor and you happen to be reading an article about heart failure on JAMA, TrendMD is there right alongside the article, presenting articles both from within that journal as well as sponsored content from around the web. So as a reader, you might see, again, an article from JAMA, but you also might see an article from another journal like DMJ or New England Journal that's been sponsored. And the key thing is that we're presenting articles that are relevant to you and hopefully to enhance your practice.
If I understood correctly, so the widget, the application itself, it can fit into it's not meant to be purely for academic journals. If I was to go on NCBI or something like that or PubMed, but it also fits onto news platforms as well.
So at first we were like, okay, we can find it. And when I say HCP, I mean healthcare provider. When we think about an HCP, I said, we're going to find them first on journals. But then along the way, we realized, well, doctors obviously are people too. They read news sources. They read they read everything else that everyone else does. So we ended up, getting our widget installed on other places like Stat News or Medical News Today. And these are sites that kind of have a medical focus, but they're not academic in nature. And again, our technology allows us to almost follow the individual HCP around, regardless of the site that they're on, and then we can recommend content that's relevant to them based on the data that we collected on them.
Right, that's really cool. Different than my initial impression, because I had a feeling that this was mostly geared toward if you're an academic or if you're taking part in academic type projects, and you're going to go looking for research, and then you're going to go on to one of these sites that are specifically designed to display and run searches on academic literature. But you're saying like even if I went on to, I don't know, CBC News and something, just as an example, like I'll be able to find it in their health section, or would it just appear?
The network itself is comprised of around 5,000 different websites. CBC is not one of the websites that are currently participating in the network. They might be in the future, but currently they don't. But that would be an example. And for people that go to CBC Health, it goes even one step further. For certain sites in our network that are participating, you won't even see the TrendMD widget unless you're a verified doctor that we've identified in the network. And so if you go to the page and you're not a doctor, you're not identified by us, you would actually see nothing. So the page is actually loading dynamically. And that actually is very common with advertising. When it comes to advertising on the web pages are often dynamic and they're so-called personalized to the individual. So TrendMD kind of fits into that ecosystem.
So then you've got, you basically, you have, a list of, I don't know if subscribers is the right word, but these are HCPs that you've already, I guess, spoken to or, identified in advance. And then based on like their cookies that got installed in their system, if they're browsing, is that the way to kind of target?
Without getting too technical, the best way to think about it is it's a digital fingerprint. So every user on the internet has a digital fingerprint associated with them. And what's a digital fingerprint? Well, it's a bunch of different identifiers, from your browser settings to your cookies. It literally, as the name implies, it's a fingerprint. There's actually a project that was done out of MIT. I think this is pretty long ago. It's called panopticlick.org. And it's a really nice tool because you can see your own digital fingerprint using this tool. It's an open source project. And physicians that are, or HCPs that are involved, have opted in to allow this. So it's part of our system. And we've also partnered with third-party companies where the HCP has opted in as well. So this is all kind of first-party data. All the users have opted in. That's the best way to think about it.
And you mentioned it's got something around like 5,000 websites or services that are currently used?
Currently, TrendMD is used by over 5,000 different websites.
Okay.
Many of those websites are journals. Some of those are not journal sites, but it's kind of a mix. And then overall, I don't know the numbers off because I'm kind of disconnected in some ways from the company, but I would say around 3.5 million unique individuals have been identified. So we can actually target on that basis. But in the network, just to give you a sense, so over the 5,000 websites, we're reaching over 100 million unique users per month. And of those 100 million, we can actually identify specifically around 3.5.
Can you tell anything, just out of curiosity, about different specialists? Like who's really using the service the most?
Actually, what's interesting about that is that because TrendMD is embedded almost as a backbone, so to speak, of the ecosystem, we don't find people don't actually come to TrendMD and say, "Hey, I'm going to use TrendMD." You would more, if you ask a physician or you ask someone, they don't even know they're engaging with our product because they're just clicking on recommended articles. Right. So in I would say in most cases, there is a powered by TrendMD button at the, or icon at the end of the widget, but in some cases it's not. It's really up to the publisher or the website owner. So I wouldn't say there are differences. I would say overall, though, we tend to reach, obviously, we kind of mirror the overall breakdown of physicians in the universe, so to speak, which is, we tend to reach most GPs, and then it kind of falls off. So it kind of matches the overall breakdown of physicians versus specialists.
Gotcha. Okay. And I've definitely come across the icon too. And, before we had a chance to meet, I wasn't sure where that was coming from, but like now I know. So that's awesome. I've seen it quite a few times. Cool.
Yeah.
Okay. So maybe let's back up a little bit and just kind of go back to, so the company's been around since about 2013, if I read that right.
Ish. It was publicly launched in 2014, May of 2014.
Okay.
Yeah.
Okay, perfect. All right. So about 2014, and back then I imagine that there probably been a couple changes in how research is done in bibliometrics and so on. So going back to that mindset, what was the initial sort of problem that you identified, and what was the need back then? So
for me, so actually the idea or the underpinnings of the company actually date back to almost 2012. I still remember, it was April 2012. And for the time, I was a medical student, and I had just published my first paper. And I remember being extremely excited about, getting published and, all the work that I've done, all this in payoff in this public journal. And I remember going up to my supervisor and, he kind of looked at me a little bit dead-eyed and he said, this is not really a big deal, Paul, go back to work. If you want to make a name for yourself in academia, you really have to publish a lot. And, instead of having kind of the existential crisis, which may or may not have happened following that, I turned some of that disappointment into something, I thought would be useful, which is, I started thinking about this problem set, which is, why is it that, as a researcher, you pour hundreds of hours into a paper, only to be one of 8,000 papers that are released every single day? Okay, so how do I get discovered as a researcher? So that was one problem. The second problem was that, how as a researcher can I discover other relevant content? So those two problems I was wrangling with, and they were all kind of under the discoverability issue, which is that from a researcher perspective, how do I get a name for myself? How do I generate impact? And then from a reader perspective, how do I find things that are interesting to me? And at the time, I think I had posted something on on AngelList, which was a very nascent platform in 2012. I think it just had started. And someone in San Francisco, who eventually became my business partner and now one of my closest friends, reached out to me. And we got to talking. And at first, he actually thought that I had a product and he wanted to use it. Then I told him, I'm like, his name is Alan. I was like, no, Alan, I don't have a product. I have nothing to show for, but do you want to help me build it? So that was kind of our first meeting, and we developed a relationship from that. And about a year and a half after that initial meeting, he was the one that actually came up with the concept, being suggesting Outbrain for scholarly content. And for those that don't know, Outbrain is the main product that services the consumer web. So if you go to Outbrain, you'd see content recommended for you, and that's the places that you see on CNN and things like that. So we kind of merged our two brains together, and we came up with a solution, and then we launched the product in May of 2014.
Okay, so May 2014, and you had just met Alan, which is a cool story.
But a year and a half prior to that, I'd met Alan.
A year and a half prior. Okay, yeah. Okay, and so what? Take me through like the first couple of steps. So if you decided it's an awesome idea, clearly there was a need for it. You're addressing a problem that a lot of people were having, trying to build a name for themselves and become recognized in particular fields. So how do you go through idea to taking the first couple of steps?
The first thing was building a prototype, and we were also very fortunate in the sense that we did have a third co-founder who was not very much involved in the later stages of the business, but very important in the earlier stages. His name is Gunther Eisenbach, and he is the owner of a group of journals that's known as JMIR Publications or JMIR Publications. So he was not only a co-founder, investor, but also our first customer that we were able to beta test the initial product on. So when we launched the product, it was pretty bare bones, pretty basic. As they say, this is a minimum viable product, and we got it up on Gunther's journal. And in Gunther's journals, JMIR is pretty much, I would say, the top journal in health informatics. So it's a pretty well recognized and e-health, very, very well recognized group of journals. In fact, about a month after, from what I recall, maybe it could have been 2 months. So this was in June of 2014. I was contacted by the British Medical Journal, so BMJ, which is probably one of the largest medical journals out there, asking if they could use our product. So it was right then, actually, that I actually took a leave of absence from residency at the time to then kind of pursue this, because I knew that this is not just a one-off. This could be a real business. Because at first I was like, maybe this is just an academic project. Maybe this is not going to go anywhere. But it kind of grew its own legs following that.
It almost sounds like, so you had customers or potential customers, I guess, reaching out to you because they had heard something about it and they thought
they saw it. They actually,
okay.
They literally saw it on his journal. They said, "What's that?" They saw the Powered by TrendMD logo, and they reached out. So they literally saw it, and that's one of the benefits of the business model. It kind of advertises itself, right? When it's being used by the more it's being used, the more it's being seen, the more likely someone will contact you, right? So it's kind of free advertising.
And when you've got people actually reaching out to you and asking, like, how do we get a hold of this, rather than, I guess this is kind of the juxtaposition of having to, as a startup, you might have to do a lot of heavy kind of marketing, advertising, a lot of business development to try to get your name and product out there.
We did.
And you guys do that too.
Yeah. So I would say, despite that initial success, starting a business, as probably your viewers know and anyone knows, is not easy, and businesses don't sell themselves. You can have strong product to market fit, but that still doesn't mean the product is going to sell itself. So in the case of TrendMD, at first I was the only salesperson, but we quickly grew that with and finding that we needed, obviously, insiders in the industry to sell this product to other journal providers and publishers. So it was certainly an active process, I would say, that was enhanced with marketing efforts, essentially.
Okay. So this is kind of interesting. So I'm just trying to think of, your background, you were initially in medical school. This idea kind of popped up. Yep. You were publishing, getting into research. Did you pause through the middle of medical school to build this?
I've gotten used to wearing lots of different hats. So in 2012, I graduated medical school in 2013. And then I started residency at the University of Toronto in 2013 in psychiatry. And I put that on pause when I decided to pursue TrendMD, but technically it was more of an academic pause. It depends on who you ask, but so during my time, I took 5 years off. We grew the company. So I was the CEO of the company. I grew the company to what it was, to run just over 80 employees. And also I completed my PhD during that time, which was in the area of bibliometrics and knowledge translation. So different hats: researcher hat, business hat, medical hat. It depends on what I'm doing.
I don't know how you managed to fill all those different roles. It's pretty impressive, I got to say. At this point, okay, so you've got also.
I say lack of focus sometimes, but sure.
Or creative genius, or whatever we want to call it. It's all good.
Good.
So you've got so you mentioned the key sort of team members that you were working with at the time. Was this just, a good personality fit? How did you kind of pick and choose the people to work with to start building this out, especially in the early phase?
Do you mean between my co-founders, or do you mean early employees?
It's a good question. I mean, I suppose co-founders is the main sort of starting point, right? So how did you guys decide who to work with?
Yeah, so Alan and I, have a very special relationship, and I feel immensely privileged to have been able to have this in my life, in the sense that and in many respects it's strange because we internet dated. Effectively, and I have a wife, but he's my other partner, and I didn't meet my wife on the internet, so but I met him on the internet.
You tried both.
Yeah, exactly. So we just one of the ways that we've gotten along, I think, or one of the common threads between him and I, is that when we do disagree about things, because disagreement is a natural side effect, so to speak, of working together. It should happen. It's actually a good sign. It's how you solve the conflicts that you have between you. And between Alan and I, persistence was always something that was extremely important. And what I mean by that, if I unpack that, it's this persistence to discuss. We don't really bury things under the rug. If something's bothering us, we feel the need, and we feel safe enough to discuss it. Because we knew that either one of us would be persistent enough to stick around in the relationship. And if you want to generalize, I think that's actually one of the most important things between co-founders. And I would argue that one of the reasons I think why early stage companies fail, and this is not just my argument, I think I've read this a number of times, is between co-founder fighting, when they don't get along, and the business kind of dissolves as a result of it. So I would attribute a lot of our success, frankly speaking, that came to the relationship, the special relationship between my co-founder and I. So I'm not sure if that answers your question, but that's, yeah.
I think it does. I'll kind of flip it around and see if I can ask it in a different way. Was there anybody that you started working with pretty early on that you realized with relatively quickly that it just wasn't going to be a good fit? They weren't going to be able to contribute in the way they initially thought?
So there were absolutely employees that or early stage employees that that came on that just weren't a good fit between Alan and I. And I think that particularly with an early stage company, again, this is kind of a generalized advice, is that it's really, really, really important to be ruthless early on, because if you're not, all of a sudden you'll wake up one morning and the company that you have is not the company anymore that you really wanted to create. So your early stage employees actually set the tone for the culture of your company. And again, a lot of what I'm saying is almost cliche at this point, in the sense that you go on the internet, you read it anywhere. But I lived it and breathed it. It's very important to have the company culture you want to cultivate.
Really different experience, I imagine, like kind of reading it versus you having intuitive understanding versus experiencing it. Yeah,
absolutely.
Okay, so I'll kind of I'll back up a little bit again too. So there are a couple of things I wanted to ask about TrendMD itself. One is and I read a little bit about it, so I was really curious to get your perspective on this idea of collaborative filtering. And I don't know if that's the right keyword, but I suppose it's what's the main sort of add-on here and difference between traditional sort of matching to people's preferences based on, I don't know, keywords or titles or author names, what have you, versus the unique aspect of TrendMD? So we'll start there.
With many recommender systems, at least in academia, so for example, if you go to PubMed, most of the time when you see related articles on PubMed, they're based on semantics, based on the relatedness of keywords. With TrendMD, we took a slightly different perspective, which is that and this is again coming from my co-founder's lens, who is more of someone that has done entrepreneurship in the consumer spaces in the world. He looked at this and he said, what are companies like Netflix and Amazon doing when they recommend movies or content to you? They're not actually necessarily looking at the relatedness of two objects, but they're looking at what people are actually doing. They're looking at user behavior, either individual user behavior, as in the case of Netflix, or more group behavior dynamics, as in the case of Amazon. So technically speaking, and collaborative filtering is a technical term, it describes Amazon's process, which is, people like you have read this, you may like this. So it's trying to predict relationships in objects that are not just based on the relatedness of objects. So I'll give you a hard example of this. So if we were using just plain old, if Amazon, for example, were using plain old relatedness to generate recommendations, if you bought a tea bag, they just recommend 5 other tea bags for you to buy. Now, obviously, to us right now, that's illogical, right? That doesn't make any sense. If I've just bought a tea bag, I don't need more tea bags. But what Amazon learned is that it groups the behavior together. So people that buy tea bags often buy teapots next. So it generates that recommendation. So again, people like you have bought these items. You may like these items because you just bought a teapot or a tea bag. So in the case of academia, we kind of use the same logic to apply. So for example, if you've just read an article about lung cancer, we're not necessarily going to recommend 5 other identical review articles about lung cancer. We might recommend an article about smoking, or we might recommend an article about pancreatic cancer because there's some connection between the two, or people that have read about lung cancer have also read about pancreatic cancer. So it's really interesting because, one of the things that we've learned along the way, and again, this is from a sales or business development perspective, is that when the publisher or the journal owner is looking at the quality of the recommendations, they look at it and they said, so-and-so at TrendMD, we don't think that your recommendations are high quality because you're recommending irrelevant stuff. and then we say to them, we're like, well, no, it's what your users want. So if you look at, and the way that we measure the quality, so to speak, in our mind, is we look at the data. We look at the degree to which people see recommendations and the degree to which they actually click on recommendations, i.e. the click-through rate. And our system is tuned to that, just like the system on Amazon or Netflix is in some ways are tuned to engagement or click-through rate. So it's always an education process actually, because and in many cases, the editor will say, no, I want to bias the system. I want to make it so it's showing more related articles. And when that does happen, the quality, so to speak, as measured through engagement rates, actually does tend to fall off a lot. So it's an interesting question you pose. We've often had to educate, I would say, a lot about this.
You're right. I think there's a little bit of a disconnect between what you might think a system like this, how it would operate versus
how it does.
Versus how it actually does, right? I mean, if you're going into I don't know, a grocery store or something like that, what do you find if you go down aisle 6? Basically, like 500 versions of whatever that main product is. So rather than seeing a lot more of the same thing, you're kind of talking about going off and pairing things up, almost expecting what people might want to pair up with whatever that main product is.
And that's a very interesting analogy if you're talking about what happens in physical stores, because what happens in physical stores is more along the lines of what relatedness does, right? So if you go down the aisle, so to speak, of tea bags, you're going to see other tea bags to buy.
Right.
But I would argue that the context matters in this sense. So it's much easier to stock a store if all like items are together. And also it's easier to navigate from a physical perspective because you're physically moving from one aisle to the next. The nice thing with digital is that you're not doing that. You're not actually moving from one aisle to the next. You're just scrolling through a page. But it's interesting because we've obviously we've done all sorts of empirical tests, so to speak, on whether or not relatedness drives engagement. And we find time and time again that no, relatedness is not something that drives engagement. And I think for many people that is counterintuitive. And I mean, these experiments have been done on us, at Amazon and Netflix for a long time. And they figured out what makes us click and what makes us stay engaged.
Mm-hmm, mm-hmm. So I'll ask one kind of follow up on this point, because I think it's just such an interesting point. And obviously Netflix and a bunch of other services having so many different users, we're at a point where I think most people understand how these things work, right? I mean, you do your checkout on Amazon.
Yeah,
superficially anyways, yeah. And then it always it'll figure out what other users have bought based on, similar kind of initial requests and stuff like that. So, but I guess in the context of, clinical research and, or research in general, whatever the field might be,
mm-hmm.
One of the first impressions I had was some of the greatest kind of inventions, I guess, if you will, or innovations have come from ideas being borrowed from other disciplines. And so if you keep seeing a lot of similar sort of content, does that detract a little bit in the grand scheme of things?
So that's another really good point, kind of the relatedness bubble, I like to call it. So that's a big problem in research, and many of the world's most important discoveries have come from what we consider to be interdisciplinary. I underline the part "we" is because disciplines are social constructs; they're not real. Right? There's no such thing as physics. There's no such thing as chemistry. It's a human construct. So these arbitrary divisions are made by us. But the real world of science underneath that doesn't really care about disciplines. It's all one. So I think, bringing it back to TrendMD, I think that we, in some but not always, foster serendipitous discovery. Because again, if we were only relying on the relatedness input, then you would truly never find articles outside of your said discipline or outside that are directly related to your discipline by the keywords that are being used. So I think that introducing a layer of personalization and collaborative filtering actually does increase serendipity. Can I test that hypothesis empirically? No. I can't. I don't. At least nothing off the top of my head that I could think of that would test that hypothesis. But it's in my intuition that I think that we increase serendipity.
Mm-hmm. I agree. That would be really tough to actually do in reality. But I suppose that's what conferences are for, where you kind of bump into people and bump into totally different ideas from different disciplines.
Absolutely.
It's an interesting thought, though, for sure.
Yeah.
Okay. So you also mentioned TrendMD is evidence-based in the sense that you guys have done a lot of studies. Not only for marketing purposes, but it really is an algorithm and a tool that really does work. I wonder if you can kind of dive into some of the findings that you guys have done in comparative studies and so on.
That was actually my PhD thesis. So, and that's what makes kind of TrendMD, I think, unique as a business in the sense that it is kind of an evidence-based tool. Of course, I have a financial conflict of interest, which I disclose in my research, but notwithstanding, the research was produced. So we've done, we've published 4 papers in this area. I won't talk about all 4, but I'll talk about the last one, which was the most relevant one. So the overall, I'll actually start here. The overall goal of my PhD was to examine to what extent, if at all, TrendMD as a cross-publisher recommendation tool confers a benefit to visibility, usage, or impact of articles. So visibility being we defined as an increase in page views, or the usage we defined a different way. And then ultimately the question really was that if we're promoting articles in the TrendMD network, does this actually lead to a citation benefit or a citation increase of those articles that are promoted? And in short, the answer is yes, at least in some disciplines it does. So most recently, in June of 2019, we published a paper showing it was a randomized control trial, including, I believe, 3,200 articles. 1,600 were promoted in the network, 1,600 were control, and this was done across 8 disciplines. So it wasn't just in the health sciences or medicine; it was actually in chemistry. It was in all different disciplines, even business, social sciences, humanities. And we found that overall, after 6 months of promotion, we measured a citation benefit both at 6 months and at 12 months. So there was actually an overall 50% increase in citations conferred to the articles that were promoted after 12 months. Then when we looked at the actual disciplines that found this benefit, it wasn't all of them. We found a benefit in health sciences, life sciences, as well as physics, actually. So non-life science, but we didn't find a citation benefit in the other disciplines like business or humanities. That being said, we did find a usage benefit in 7 of the 8 disciplines in study. And we think, at least I think, that for disciplines that didn't see a citation benefit at 12 months, I think that when we examine them at 24 and 36 months, which we are planning on doing, I think that we will see citation benefits. Meaning the reason why we didn't see it at 12 months is because the publication cycles in these other areas are slow. Medicine, physics is very rapid, and therefore you tend to see the citations accrue more rapidly on articles. So we'll see. We're doing another study. We're doing a re-examination of the data probably next year.
I'm super curious about this kind of thing because was this, when you went to do your PhD, was this a direct kind of result of sort of a need to incorporate these ideas into TrendMD, or was that, did the two kind of intersect just naturally?
So it was intentional in the sense that, I mean, one has to have intent when they're doing their PhD. So I did intend to do a PhD. So to answer your question, yes, it was certainly intentional. Yeah, I'm not sure if that answers your question, but it was definitely very intentional to do the research.
Right. I'm again, like like you were saying, you've worn so many different hats, and you've taken on so many different roles within the company. It really is impressive. Within one of the things that I was really interested in trying to understand is so you mentioned a couple of the different disciplines that you found significant results in. Was there any difference in terms of I guess, I don't know what the right word would be, but the real world type, research that is directly translational into real practice versus more theoretical type work? Did that differentiate?
Yeah, so it's a good question. So we can't really, our primary outcome that we measured was citations. Citations is a measure of one type of academic impact. It happens to be the most popular way of measuring academic impact because it's easy to measure. It's objective. Meaning, two people viewing this impact can agree that, this said article has 5 citations, although even that, sometimes there's differences depending on where the citations are coming from. But there, other than the citations, there are less objective ways to measure impact of articles. So you mentioned one. You mentioned, how does this said article have an impact on clinical practice? That's really important, obviously, especially it's really important for physicians. But the question is how do you actually measure that? How do you measure clinical impact of a paper? I don't know. I don't know how to do that. I don't know how to do that objectively. There could be somewhat, pseudo-objective ways of doing it where, you get a survey and you ask a group of physicians, was this article impactful on your practice? And you can do all sorts of fancy statistical tests by getting reliability in that. And I say this because, there are fields in medicine like psychiatry, like my field, that operates without objectivity in the sense that our diseases, our syndromes are based on, they're driven by consensus rather than lab work. But it's still reliable because we've come up with a consensus of what depression means or what schizophrenia means. So bringing this back to TrendMD, you could create a clinical impact score, I suppose, and ask a bunch of physicians whether or not these said papers are impactful. You could do something the same thing. That's a much more ambitious thing to do than measuring citations of articles.
Right. Okay, we'll definitely come back on the topic of how to incorporate some of these ideas into your field in psychiatry, and what you hope to accomplish in the field as well. But just coming back to TrendMD for a second here. So, in your capacity as an advisor at the moment, and as past CEO. Has the mission, the vision of the company changed based on the evidence that's come out from how effective it is? What do you see for the future?
One of the things that's remained, although like our strategies have obviously changed year to year and the roadmap changes year to year, we always knew what the top of the mountain was, meaning, our overall mission at TrendMD was always the same, which was to accelerate the rate at which humanity's knowledge advances. Sounds like a lofty vision. And I think businesses kind of need to have a lofty vision in order to survive. Now, the way that we execute against that mission is again, that's a different topic. That's strategy, and strategy changes from year to year. It changes from month to month. But the overall mission never changed. We, literally, I can remember from the day we launched, although we may have not said it in those words that I just used, we kind of all knew that we wanted to enhance discoverability, speed up the rate at which innovation occurs. These are all kind of synonymous with our overall mission. So no, that didn't change throughout the journey.
Since inception, I'll say even before like pre-official launch up to where it is right now, what have been some of the key kind of success factors, key drivers of success in the company?
Well, one of them I had mentioned before. I think that if you want to distill everything off, I think one of the most important factors as to why we were successful was because my relationship with my co-founder, with Alan. I think that in the absence of that, I think that would have been what I think the company would have failed. But I think many companies would fail when there's founder infighting. So I think that not having that, the absence of that, a really good relationship is one of the reasons why we succeeded. I think another factor is, and again, this goes back to what I was mentioning before about my co-founder, but persistence. So we knew that our mission was valid, so to speak. The question was, what battle strategies did we need to get to that mission, to execute on the mission? That's the stuff that changed, but we knew that we had to be persistent, right? The most important thing in startup, the other important thing I should say is being, I often say, be a cockroach, so survive. If you survive long enough, you'll figure it out. If you don't survive because you run out of money or you're having founder infighting or whatever, well, you're obviously not going to be able to execute against your mission. So find ways to survive, be resilient, be scrappy. These are all things that I think that were, that I certainly have, my co-founder has, and we kind of brought this into the culture of TrendMD.
Okay. Again, a lot of this stuff is sort of the kind of things that you read about when you go into like whatever blogs or what have you on like entrepreneurship. Yeah. Totally different experience actually going through and living them, and so being able to really be super in tune with how important each one of these things is makes a big difference for the work that you want to do going forward, and being able to share that too. One of the things I was really curious about too is what do you see in terms of diversity in your customer base or in the product ranges that you guys have right now? Maybe it's one main product that's servicing a lot of different clients. What do you guys see going forward in that? Our
core value proposition at the end of the day is that we, for advertisers, so to speak, for people that want to promote their content, they can do so. So the widget allows them to do that. And on the other side, you have readers that are discovering interesting content. The way that I kind of frame what TrendMD does, ultimately, we're just a marketplace of attention. That's it. that when you boil everything off, you have advertisers that want to reach an engaged audience, and you have readers who want to discover interesting content. And what TrendMD is, it kind of sits in the middle as a broker to facilitate that transaction between people that want to read stuff and people that want to reach people. So it's all one product. It's all one value proposition.
Would you differentiate in any way between let's say a researcher that's just starting out or maybe another interesting or unique example might be somebody that's doing a lot of kind of heavy publishing in an open access journal? Is there any different kind of applications there, any way to differentiate?
No, not necessarily. I would argue that early stage researchers have an even more impetus to promote their work because they have to make a name for themselves. Similarly, people that are publishing in open access, one of the reasons why open access publishing took off as much as it did was because authors, particularly authors, wanted to have control over the degree to which their hard work is visible to others. If you go pre-2000, into the 1990s, before open access really took off, who saw your work really depended on who could pay for journal subscriptions, which was a ridiculous notion. Now, I don't think that open access has solved all of that, because I also don't necessarily think that the onus should be all placed on the authors to pay to publish their work, but that's a whole different topic. But again, the emphasis of open access is increasing the visibility of your work. What TrendMD does is kind of an add-on where not only is your work open, because we encourage that, and we want work to be open, but we at TrendMD is set up to actually disseminate and distribute your work actively to people that can make use of it. So open access and TrendMD are friends, so to speak. We're two products that go hand in hand.
Okay. That's positive. All right, good to hear. Okay, let's go a little bit into your specialty, psychiatry, and I wonder if you can tell us a little bit about, I guess how you got into psychiatry. Was this always one of your preferred specialties, especially with the break that you took in developing this company?
So psychiatry for me, what really got me intrigued in the field was the research aspect. So I was always really into research. I'm the type of person that likes, so I'll say this, when you think about physicians in general, physicians kind of fit into buckets. There are some doctors that really like the technical path, and you can think of surgeons, you can think of certain doctors that like very concrete answers to things. Or in other words, they're not very tolerant of ambiguity. And there are a lot of specialties for that. So, surgery in general is a very concrete, field where you're physically working with your hands and your brain. And there are other fields like cardiology where we really do understand, at least superficially, again, how the heart works, how it pumps, or the kidney, how the kidney, filters the blood. But then you enter the brain and all of a sudden things become very, very opaque. We understand some aspects of the brain better than we did, let's say, 50 years ago, when we think about how the brain sends signals to how our muscles move. But in my mind, human behavior and psychiatry is truly the final frontier. And we haven't really even scratched the surface yet, because we haven't defined even the most basic problems that are actually extremely complex, like what is consciousness? Why am I conscious? Why is this rock not conscious? These questions are actually not answered yet. So I think the unknown really attracted me, in the same way that the unknown attracted me to entrepreneurship. I like to kind of be in the basement, seeing around the dark, trying to feel my way through things. I think psychiatry has that appeal, and you have the potential to do a lot of good things in psychiatry, because the field is so kind of at its beginning stages. I often say, and I think I've read this before, is that psychiatry is where cardiology was 300 years ago. We're still very much in the dark. We really don't understand the way things work. And although we've made immense progress in the field of psychiatry, in the fields of psychopharmacology and some of our treatments, there's still so much left to do. And I think that frontier aspect, that aspect really attracts me to the field. So again, it was a very intentional choice, picking a specialty like this.
So it sounds like you definitely want to have an impact in psychiatry yourself. Is there a particular area that you want to focus in?
Maybe. so I don't know. I think right now, I'm kind of heads down. I'm going to complete my residency, which is about a year and a half remaining. And then following that, there aren't any. I'm kind of interested in general psychiatry. I'm still kind of exploring. I wouldn't say I have a definitive path. And I think that regardless of what I do, I think psychiatry will be probably part of my career. It won't be my career in general. I'm interested in all sorts of things. I'm still very interested in entrepreneurship. I've gotten, as of late, interested in angel investing and also venture funds. And this is something I think that I hope to incorporate into my future career. So again, this is working with my previous co-founder in this regard as well. So I think that my career is still developing. I'm still determining where I go next.
And do you see yourself staying on as an advisor to TrendMD?
Yes, absolutely.
Okay.
So absolutely, I see myself staying on as an advisor for TrendMD. So there are some knowns, I would say. So that is certainly a known. I would say another known is that I will do at least some clinical work. Whether I'm working in the emergency department in emergency psychiatry or chronic care, that I don't know. But the question is what does my split look like? Do I spend 25% of my time doing that, 25% of my time doing angel investing? Don't know. That's the stuff. The devil's in the details for that, I would say.
So you're going to keep wearing like 4 or 5 different hats, basically, going forward.
Yes, that is something I like to do. It's not necessarily my ADD, although it could be. Who knows? But I like to do different things.
I like it.
Keeps me engaged.
That's awesome. I think I'm the same way in that respect. So this kind of gets into an interesting part of the conversation here because now I'm thinking back to this really diverse background that you have, this non-traditional path that you've taken,
Mhm.
and I guess I'm wondering, you probably have a lot of classmates, a lot of friends and colleagues that are maybe thinking about these sort of things, but they're not quite sure how to get started, or if it's even for them. So how do you, what would you say to other people that are, let's say, in medicine or going through residency or
Mhm.
anything like that, and have this sort of itch to do something in the entrepreneurship world?
Yeah, so I think that the important thing here, if you're curious, follow your curiosity. I mean, that's the best thing I can say is that try to live. And this is my own philosophy. I try to live in a way that will mitigate future regret, for better or for worse. And obviously I would say we're not all. I don't think I have a perfect crystal ball into knowing what I will regret and what I won't regret. But I do the best I can. So if you're a young person that just started medical school and you're not sure if this is for you or if you want to get test the waters in something else, do it. You're the only person that are holding yourself back. And I think the worst thing that can happen in life, this is my philosophy, not for everyone, but my philosophy is that I don't want to wake up when I'm 60 and say I missed out on this opportunity. Why didn't I just do this? And certainly when I jumped ship, so to speak, when I started TrendMD, that was certainly going through my head because there were a lot of people in my life that were saying, no, you have to complete residency, do your thing first, and then you can come back to this later. I didn't listen to those people, and I think that in life you'll get a lot of advice, and you have to pick and choose what's going to work for you. For me, living without regrets was kind of my MO, so to speak, or driving force.
Do you find that your experience going through the entrepreneur journey, I don't even want to call it that, let's say, founding and running TrendMD,
Mm-hmm.
did that have an impact in your perspective, I guess, as a clinician?
I think it did. I think it has, especially coming back to residency from doing something else. I mean, most people, 99.9% of residents, actually 100% of the people in my class didn't do what I did. Is my way better? No, it's just my way. And I do think it has given me different perspective, both in terms of how the quote real world works outside of medicine, how business works, how entrepreneurship works. And I think that what's interesting is with medicine, I would say there are a lot of things I think that medicine can learn from entrepreneurship, and some things they can't. So medicine, you can't take risks because if you take risks in medicine or too many risks in medicine, people get hurt. In entrepreneurship, the lens is different. You need to, as I don't know who coined this first, probably Mark Zuckerberg, move fast, break things. You can't do that in clinical medicine, or at least you can't do that to the fullest extent. And in fact, when entrepreneurship tries to do this, we get things like Theranos, right? So we know what happened with Theranos. There
Right.
was fraud, and there's fraud in the startup ecosystem. But when Theranos did it, people actually were hurt. So I think there are things to learn, and I've kind of taken. I think I've taken some learnings from entrepreneurship in terms of how I view new clinical treatments or what new clinical treatments to try, for example, given the risk ratio. But certainly it's given me. I'd like to think it's given me a different perspective because I've had a different journey than most
Mhm.
doctors.
We often learn from just doing something completely different and bringing that into our everyday, and then all of a sudden it changes the lens. Everything
Yep,
can even go upside down. Um, so,
absolutely.
so Paul, have there been any setbacks or kind of major challenges that you had to overcome? Have there been any kind of key learnings from that you can pass on to others?
Um, I've been thankfully very fortunate in that, of course, there were setbacks along the way. There were many times that we nearly ran out of money. Um, many times that we thought the product was going to fail, the business was going to go bankrupt. Um, this goes back to a point, and I hate to be a broken record, but resilience and persistence in the face of adversity is pretty much the most important thing you can have. I don't know if that's a thing for start, and I would actually generalize that. I think in life, If you're not brushing up against boundaries, you're probably not pushing yourself to your max anyways. So adversity is a natural byproduct of success. If you don't encounter adversity in life, then you're doing something wrong. So in life, you actually, and it's funny, one of the things I look for, I don't shy away from adversity. I don't know if I look for it per se, but I find it. And if you find it, don't back down from that, that dog fight, so to speak. Keep going. And if you fail, you fail, because and my attitude is, if you fail, you'll probably learn something from it anyways. So who cares? Just keep going. Brush off your shoulder and just get up. That's kind of been my MO. So I don't have a specific, this thing happened that was really bad and I learned this. It's more of like the chronic exposure, so to speak, of things not going the way that they were probably initially intended to go, but that's okay, because you learned a different way that's probably more effective anyway.
Did you ever get kind of desensitized to it, or is this something you just have to deal with?
In life, you do get, and there's an old adage in life, I'm sure everyone knows this, is that whatever doesn't kill you only makes you stronger. That's basically what I'm saying. Is chronic exposure to stress naturally lead you to down? No, actually. So this is me putting down my psychiatric lens on this, is that no, for certain individuals, chronic exposure to something like this, adversity, might actually hurt. And I think there's a everyone is different, and I don't think there's one common thread, but for me at least, adversity seems to help me go further as opposed to harm me. But then again, maybe I haven't exposed to the ultimate adverse stressor, and hence I started this your question by answering and saying that I've been very fortunate in life. I've had privileges, and maybe that's why I'm able to speak from this position of privilege and say, well, adversity is helpful. For some people, it's not. So it depends.
Gotcha.
That's kind of my medical / entrepreneurship way of answering a question. Yeah.
It's a perfect melding of the two. All right. So I'm thinking I'll ask maybe one final question, and then
Sure.
I'd love to, if you have any kind of closing thoughts, I'd love to hear from you as well before we wrap up. So you are you got your family started as you were going through residency, or is this while you were still running TrendMD?
So when you're like married my partner, do you mean, or when you say family,
I suppose, family life, whatever that might mean to you.
Yeah. So I had my wife and I had welcomed a child last year around this time, so July of 2019. She's now just over 13 months. It's crazy. That's a crazy different experience. It's been absolutely amazing, humbling to be a father. It's been an amazing journey. So technically the way it worked is that I stepped down from TrendMD in I guess it was around February or March 2019. So my wife was already pregnant at the time. And then in July we welcomed our firstborn, and then in November I went back to residency to complete. And I say just before November, I also defended my PhD thesis. So in October of 2019, I defended my PhD thesis. So it was last year was kind of intense. There was a lot of new things that happened in life. But yeah, it made for a great year.
Jeez. Yeah, no, belated congrats on
Thank you.
starting your family.
Thank you.
The real kind of final question here is, there are people that are thinking about creating companies or what have you at different stages in their life. Is would you say is really important to find people to kind of support you, and especially those in your immediate circle, your close friends, your family? Was that an important part?
Absolutely. So for me, family, friends, you need to find people, because as I'm going back to that question you asked me just a moment ago about adversity, or the way I answered it was about adversity. I think you need supports in life to be able to deal with that adversity. I wouldn't have been able to do it alone. Whether it is your business partner, your romantic partner, or whomever, your family, I think you need someone or people, groups of people to rely on in order to get you to those darker periods.
Mm-hmm. So Paul, that's pretty much from everything from my end. If you've got any kind of final thoughts, I'd love to hear from that. Otherwise, it's been fantastic having you on, and look forward to hearing more great things coming from your way.
Great. Thanks. Well, thank you again for inviting me to your podcast. It was a great experience, and thanks for listening to me for the last hour. So thank you.